Chief Director for Social Crime and Substance Abuse at the Department of Social Development, Siza Magangoe, joins us to unpack their programs to help address alcohol and substance abuse. The department's Minister Lindiwe Zulu opened the 7th biannual Global Alcohol Policy Conference, which aims to look at policy and legislation into alcohol and substances. And she joins us now via our video link. Siza, thank you so much for joining us here on the late edition. Of course, today kicked off your first ever Global Alcohol Policy Conference. Perhaps tell us, how did day one go?
Good evening to you and your listeners. It went very well. We had robust discussions. We dealt with the issues of underage drinking as a concern, particularly for us as South Africa as well as Africa at large. We looked at the implications of that to say, there's far implications for us to really, have the issue of underage drinking, because it does impact on school dropouts, unsafe sex, teenage pregnancy, and so on. The list is just endless. So those were the concerns. And we also spoke about what is it that we can do as government, as communities, and as a country at large to cap really the abuse of alcohol.
And we've just spoken about, the insert we just ran speaks about an alcohol problem we saw last year in the Eastern Cape at the Enyobeni Tavern, where a number of young people died, and those, most of them were said to be underage. And when it comes to the contributions they made, when it comes to dealing with underage, substance abuse, so what were the contributions made there to try and address the challenges of underage drinking in the country?
First thing we said, we need to deal with the denial that we are dealing with as a country. For instance, we're saying when you look at the issue of substance abuse, it is we tolerate alcohol and we demonize tobacco, and that is a problem, because both are substances, and both are substances that are legal, and both are substances that are affecting us, at all levels, be it, at a social level, physical, and so on. But we tend to be more tolerating when it comes to alcohol. The other issue that we also dealt with was the fact that alcohol has become a normalized substance in our country. Until we confront those issues, there's not much that we can do until we really come to the drawing board and say, what is it that we need to do? What kind of legislations we need to put in place? What are the programs that we need to upscale, and what is the mindset that we need to have in order for us to confront the problem before us and save our children.
And Siza, going back to this 3-day conference, as the Department of Social Development, why did you see it necessary to highlight these key problems when it comes to substance and alcohol abuse in this country? Why is it so important for the department to meet over 3 days to discuss the various challenges the country faces when it comes to, substance abuse?
It is important because substance abuse, particularly alcohol, is one of the social ills that is increasing and it's impacting on so many lives. It's also alcohol has been regarded as one of the drivers of gender-based violence, and we have high levels of gender-based violence in the country. So we cannot afford to sit and not do anything while the research is already pointing us at areas that we need to deal with. We also have a problem of too much availability of alcohol. When you look at our policies and legislation are not so, are not so stringent. We are not responding at the country that is in crisis as far as alcohol abuse is concerned. So we therefore need to look at it and say, what is it that we need to do to put in place that will assist us to cap the abuse, because the abuse has reached high level. We cannot ignore this problem anymore. We cannot afford to walk away from this problem. We need to address this as government, as communities, and as a
And what is the significance, of you gathering over 3 days, and the significance particularly when it comes to this conference? I mean, you're talking about, where there are, various problems as a country we are facing when it comes to substance abuse. But when it comes to the significance of this conference, how important is this conference?
It's very important because, one, it gives us an opportunity to benchmark with other countries, because we are not the only country that is contending with alcohol. There are other countries that we can learn from who had this problem before, but now they've turned things around. So we are here to learn from them. How did they deal with it? We are also here to share best practice with them. We are also here to agree on a common, approach in terms of dealing with this problem. So it is a platform that really, give us an opportunity to assess where are we in terms of the policies, in terms of the interventions, and also, embracing other interventions that could really assist us to turn things around.
And now that you've dealt with underage drinking in the conference, what can be expect for the next 2 days? Because we understand that this conference continues.
Yes, we'll be focusing on issues of harm reduction. This is an important thematic area for us, because for too long as a country we have been understating the harms that have been caused by alcohol. So we will be, bringing evidence before everyone to say this is what literature is saying. One thing about numbers do not lie. So we will be looking at what is the statistics telling us as a country versus other countries, and then look at the harm reduction strategies that we have. Are they effective? If they are, why our numbers are going high and not going down? So we'll be looking at those strategies that we have, and make sure that we come up with strategies curbing alcohol. Things like, for instance, we're concerned about drinking and driving. We're concerned about the burden of diseases that is caused by alcohol. For instance, today we had an interesting research paper that was presented that showed the direct link between abuse of alcohol and 7 types of cancers, that are caused as a result of abuse of alcohol. Things like, the colon cancer, breast cancer, all those are the burden of disease that the state it has to take a responsibility for, and make sure that we provide, in a medical intervention which could have prevented it. So those are some of the things that we're looking at. We're looking at harm reduction. We're looking at advertising. How do we, restrict advertising? What are the measures that we need to put in place? We're going to look at taxation. How can we use tax to actually, increase more funds for alcohol and fight the scourge of alcohol abuse, as well as community engagement. Because one of the key things we are saying, we cannot leave communities behind. Communities must be at the center of finding solutions. We need to hear from them. We need to really engage them so that they can stand up and fight. It cannot be the fight of government alone, but it is everyone's business.
And as you find, these solutions to the problems we are faced in this country when it comes to alcohol and substance abuse, which sectors did you invite to this conference? Because, this needs to be a collective effort so that, various solutions can be found that make sense for the country.
We have invited civil society organizations. We've invited activists in the sector. We've invited researchers. We've invited experts in the sector. We've invited Central Drug Authority, as well as government departments and members of parliament, because we are saying the solutions starts with having responsive policies. So it's important that there is a buy-in from the leadership, so that some of these policies and legislations can be amended and approved and implemented as soon as possible.
Siza, thank you so much for your time here in SABC News. That is Siza Magangoe. She is the Chief Director for Alcohol and Substance Abuse within the Department of Social Development.